Hey everyone, welcome to the show. So you may have already heard the CEO of UnitedHealth Group, it's a man named Brian Thompson. He was shot and killed on Wednesday morning. He was entering a New York hotel. His company was conducting a shareholders meeting there. He was staying there. Apparently he had left the hotel and then came back. This was in the early morning hours. The gunman waited for him and then approached him from behind and shot him 3 times. So the gun had a silencer on it. The shooter, according to authorities, said, he seemed to be proficient in handling a gun. And the reason this has become a major story is because, it's twofold. For one, it appears to be an assassination for the purpose of retribution. The shooter wrote messages on the 3 bullets. One said deny, the other one said defend, and then the other said depose. So this is similar to the title of a book called Delay, Deny, Defend: Why Insurance Companies Don't Pay Claims and What You Can Do About it. As any of us in the United States know, insurance companies very often will deny coverage, they'll deny payment for legitimate claims, and you have to fight them. And sometimes, when patients are in a dire situation, they will sometimes die while they're waiting for approval, while they're fighting, or they just don't even have the strength and energy to fight. And UnitedHealth Group has the highest rate of denial of all insurance CEOs. So as you can see on the screen, and for those on the podcast, 32% of their claims are denied. 1/3 of every claim they receive. So unsurprisingly, his wife said Thompson was receiving threats, and it had to do with denied claims. The other reason this has become a major story, and this is also no big surprise, is because a majority of the public is reacting with either a shrug or they're actually mocking this man's murder. Let me say up front, I don't think there's any justification for murdering someone. And you also have to take into account the temperature of the country. You have to consider how people are feeling, how Americans are feeling. And if nothing else, we saw that on display during this last election. So here's what's going down. Here's why this has become like a touchstone, or a barometer, I guess you could say, for the temperature of the country. Social media right now is filled with people saying that they either could not care less, right? They're based on how heinous this company is, how they behave, or people are outright gloating about his death. So I'll give you a few examples that I found. One Twitter user wrote, quote, "When you shoot one man in the street, it's murder. When you kill thousands of people in hospitals by taking away their ability to get treatment, you're an entrepreneur." Another person wrote, quote, "Sending prior authorization, denied claims, collections, and prayers to his family." One person even wrote, quote, "This needs to happen more often." Failed Democratic candidate, presidential candidate Dean Phillips, he was just brutalized. He got dragged big time on Twitter because he made this asinine comment, quote, "Seems like leftists opposed to killing terrorists in the Middle East support killing CEOs in Midtown Manhattan. Sick." Now, of course, I joined in on the dog pile since Palestinian children and babies are not terrorists, but obviously Dean Phillips can't tell the difference. Also, the hate towards greedy, callous CEOs is universal. This is not just coming, these comments are not just coming from people on the left. People on the right are also celebrating, or at least shrugging and going, oh, well, just like the people on the left. And I found this very interesting comment below Dean's word vomit. This man wrote, quote, "When my kid had cancer, his initial claim was denied by insurance. It was only reversed after my attorney's sister stepped in. I'm lucky. Not everyone has an attorney's sister. I won't shed a tear for this man. Our deaths are called cost savings. Theirs are called tragedies. Cope. And, this was not just on Twitter either. This was also on Facebook. Very similar comments. And the majority of people responded because UnitedHealth put up a post on their Facebook account talking about how saddened they were by Thompson's death. And, everyone who knew him really liked him and he was a good friend and coworker, blah, blah, blah. The majority of people who responded with a laughing emoji. Now, I will say there are also a lot of comments on social media from people saying, this is gross. We need to respect his family and, the man was murdered and this isn't appropriate, to celebrate his death. But again, a large number of people are saying, I don't care. I don't care because these people don't care about us. This really should serve as a wake-up call to the elites, to the politicians in this country who prevent us, who have kept us from having healthcare as a human right, as every other country, every other developed nation in the world has access to healthcare. And yeah, they may pay more taxes, but guess what? They actually get something for it. And we here in America bitch and complain about how much taxes we pay anyway, and we get nothing. We get huge premiums, right? The American people are pissed off. When are the elites going to figure that out? When are politicians going to figure that out? They obviously didn't get it, or Democrats wouldn't have lost the election. Right? And I'll get into that in another video where I talk about a commercial that Kamala was shut down on. One where she wanted to talk about people's pain and how she wanted to help them and corporate greed. And guess what? Her advisors didn't even air it. Had the best rating when they ran it in focus groups, and they weren't allowed to show it. Because the corporate elites that backed her, the billionaires who stuck up for her, the billionaires who went out and spoke on her behalf, people like Mark Cuban, people like her brother-in-law, who's an Uber executive, they didn't like that. They didn't like that. And I'll tell you guys, I worked for a managed care company. I worked in the pre-authorization department. So it was my job in customer service. This was one of the first jobs I had, to take the calls from patients or from their doctors, document all of the details, and send it over to our nursing department for review and for pre-authorization. This was for procedures. This was for referrals to a specialist for people who were in HMOs. So we worked with a lot of different companies. It wasn't just a specific company. We were a third-party managed care company who insurance companies contracted with and hired us to do this on their behalf. I saw nurses who were upset because they could not approve procedures that they knew patients needed. Nurses in that department had to use these set guidelines, and they could not deviate. And again, I would see how they were upset about not being able to approve care because of these BS guidelines. And so many people would just suck it up, move on, pay for it out of pocket or what have you, or suffer. And then other people would fight it. And that's exactly what this book is about. It's that you have to fight for every little bit, shred of assistance and medical care that you get in so many instances. And I found a comment by someone which really sums up how these things work, which a lot of the public doesn't know unless they've actually had a major health issue, which I have had, which one of my children has had. And let me tell you, even if you know it, even if you work in this industry, it is a pain in the ass. It is so tough to get these things through. For those on the podcast, here's what this next comment said. Quote, "My sister is an attorney. Her first job was for a firm that represented insurance companies. They gave her a file of someone's insurance claim paperwork and told her, find a way to deny it. She left that pronto." And that's what their whole motivation is. That's what their whole goal is, right? And keep in mind, UnitedHealth, according to Forbes magazine, as you see here on your screen, made $22 billion in profits in 2023. Not $22 billion in revenue, not that they brought in $22 billion, no, $22 billion in profit. That was after all of their costs. They do that by jacking up the rates every year and then paying out as little as possible. That is the business model of every insurance company in America. Their business model is designed to help as few humans as possible. That's how people like Thompson were able to score $10 million bonuses for a year's worth of work on top of their regular pay. These people are not extremely wealthy because they care about other people or because, they actually want to take care of people's needs. They get rich by denying others in need. That is the disgusting and ruthless system that we have in the US. And, for those who think, oh, it can't be that cruel, can it? Check this out. So Anthem, which is the parent umbrella company of Blue Cross and Blue Shield, they had recently announced they were going to cap anesthesia coverage if the surgery went past their, some arbitrary time limit. So let's say you have to have surgery, and for some reason, maybe, there's complications, maybe your blood pressure drops, maybe, it's more intricate when the doctor opens you up and sees what's going on, and the surgery goes longer than what they said it should be. Then you get stuck with the bill for the extra anesthesia for that extra period of time. This is truly sick. It is so dystopian. As of today, though, they decided, hey, maybe that's not how we should treat patients. Maybe that's not how we should treat people who pay us thousands and thousands of dollars every single month. Sometimes, self-employed people like myself, it is literally thousands a month in premiums. And then what for? To give their executives these insane bonuses, to make their executives obscenely wealthy? It's insane. It is an insane system. And for people who say, well, we can't do a public option or we can't do universal health care like every other country has, every other developed nation, first world country. First of all, that's just bullshit. That is what they've convinced you of so that you don't ask for it. It is bullshit because we have the largest GDP. We are the wealthiest nation on this planet. And I would posit that if we have something like, $800+ billion in a defense spending budget, you're telling me you can't use a fraction of that for health care for our people, for our nation, to save lives? I always ask, why is it we have an endless stream of money? There's never a question of how they're going to pay for it when it comes to killing people. But when it comes to saving people's lives, We can't afford it. How are we going to pay for that? I would gladly pay a little bit more in taxes than the thousands and thousands of dollars that are wasted every year on premiums and co-pays and deductibles and all the other bullshit. You know, plus you're paying for prescriptions and everything else that they're not going to cover. So this is why people wanted to blow up the system. This is why people voted for Trump. And yes, it was wrong-headed. It was, just nonsensical with who he is, with how he governed the first time and what we can expect the second time. But people are tired of the status quo, and this is why. And so you see it in these comments. And again, I really hope that the right message is taken from this. Not the pearl clutching and the, couch fainting and all the other BS about, oh, you can't say something so rude and blah. Oh, he has a family. Yes, he has a family. He had 2 kids. He has a wife. I feel horrible for them. I really honestly do. At the same time, I feel absolutely horrified by the fact that men, women, and children are dying in this country every goddamn day because they don't have health care, or because they have inadequate health care, or because companies like this, like UnitedHealth Group, arbitrarily deny their claims because they want to save money, because their CEOs need that extra $10 frickin' million bonus. So spare me the outrage. Unless you care about every person in this country who has lost a loved one to this sick, quote unquote, healthcare system that we have, then I don't want to hear your outrage. I don't want to hear your crocodile tears. It's bullshit. It's total bullshit. So anyway, that is my rant for the month. 2 wrongs don't make a right, but you know what? I think if you looked at the scorecard, there are way more people who have died because of UnitedHealth Group. All right, I will let you all know when or if I hear more. Thank you so much for watching and listening. Please like, please share and subscribe. Please donate if you can. Love you all. Take care. Talk with you soon.